Have you ever sat in a doctor's office, watching the cuff tighten around your arm, waiting for that number to appear, and felt a small flutter of anxiety about what it might be? That moment is so familiar it barely registers as noteworthy. But here's what's interesting. That number, the one that may determine whether you leave with reassurance or a new prescription, is far more fragile than most of us realize. It can shift by 10, 20, even 30 points based on factors that have nothing to do with the actual condition of your heart or blood vessels. The position of your arm, whether you crossed your legs, what you ate or drank an hour earlier, even the simple fact of having a full bladder. And if that number is wrong, if it captures a temporary spike rather than your true resting state, then every decision that follows may be built on a foundation of misunderstanding. Today, we're going to explore what it really means to measure the body, and why the art of getting it right may be as important as the numbers themselves. You are listening to the Longevity Library, where we archive the wisdom of healthy aging. The measure of health, rethinking how we understand and track our well-being. There is a particular moment that many of us have experienced countless times. You are sitting on an examination table, the paper crinkling beneath you, watching as a nurse wraps a fabric-covered cuff around your arm. The cold disc of the stethoscope touches the inside of your elbow. The cuff tightens, then slowly releases, and within seconds a number has been generated, a number that will be recorded in your chart, that may prompt questions or concerns, that might even lead to medication or further testing. This ritual, repeated millions of times daily in clinics and hospitals across the country, has become so familiar that we rarely stop to consider what it actually represents. The measurement of blood pressure, like so many health metrics we track, appears deceptively simple. A machine or a trained professional produces a reading, and we accept that reading is truth about the state of our bodies. But beneath this apparent simplicity lies a complex interplay of physiology, environment, technique, and interpretation. The number on that screen or gauge is not a fixed truth about your health. It is a snapshot, influenced by dozens of variables that have nothing to do with your underlying cardiovascular condition. This reality extends far beyond blood pressure. In our modern approach to health, we have become increasingly reliant on measurements, numbers, and metrics to tell us how we are doing. We track our weight, our step counts, our sleep hours, our heart rate variability, our cholesterol numbers, our blood sugar readings. We have been taught that these metrics provide objective windows into our well-being, and in many ways they do. But they also carry the potential to mislead, to create false reassurance or unnecessary alarm, to reduce the complex experience of being alive to a series of digits that may or may not accurately reflect what matters most. The question this raises is not whether measurements have value. They absolutely do, but rather how we can approach them with greater wisdom. How can we obtain numbers we can trust? How can we interpret them in context? And perhaps most importantly, how can we hold them lightly enough that they serve our health without dominating our sense of well-being? These questions become increasingly relevant as we move through midlife and beyond. The older we get, the more measurements we accumulate, the more numbers we are asked to track, the more frequently we find ourselves in that crinkly paper moment awaiting a reading that may shape our next steps. Learning to navigate this landscape with skill and perspective is itself a form of health practice, one that deserves as much attention as diet or exercise. The body in numbers. A brief history of measuring health. The impulse to quantify the body is not new. Ancient physicians felt pulses and examined urine, looking for patterns they believed revealed inner states. But the tools available to them were limited, and their interpretations were necessarily subjective. A pulse could be described as strong or weak, rapid or slow, but these descriptions varied from one observer to another. The modern era of health measurement began in the late 19th and early 20th centuries, when technological advances made it possible to capture physiological processes in numbers. The sphygmomanometer, the blood pressure cuff, was refined into a practical clinical tool. The thermometer became standard equipment. Scales grew more precise. Laboratories developed methods to analyze blood and urine chemistry. This quantitative turn represented genuine progress. For the first time, physicians could track changes over time with some consistency. They could identify patterns that predicted trouble before symptoms appeared. They could evaluate whether treatments were working based on something other than patient reports of how they felt. But this progress also carried an unintended consequence. As measurements became more sophisticated, they also became more authoritative. The number on the gauge began to carry more weight than the person's experience of their own body. Patients learned to defer to the readings, to worry when numbers deviated from some ideal range, to organize their lives around achieving better metrics. This dynamic has only intensified in recent decades. Home blood pressure monitors put clinical measurement in everyone's hands. Continuous glucose monitors reveal how food affects blood sugar in real time. Wearable devices track heart rhythms, sleep stages, and activity levels with remarkable precision. We have more data about our bodies than any generation in human history. And yet, for all this data, confusion persists. People obtain high readings at home and panic, only to discover their monitor was inaccurate or their technique was wrong. They obsess over daily weight fluctuations that reflect nothing more than hydration status. They make drastic lifestyle changes based on a single cholesterol test that might have been affected by what they ate the day before. The problem is not the measurements themselves. The problem is that we have not been taught how to use them wisely. We have been given tools without instructions, numbers without context, metrics without meaning. Learning to generate reliable measurements and interpret them appropriately is a skill, one that becomes more valuable with each passing year. The architecture of accuracy, creating conditions for trustworthy measurements. Every measurement we take of our bodies is an interaction between our physiology and our environment. The number that emerges reflects not just some fixed internal state, but the specific conditions under which the measurement occurred. Change those conditions, and the number may change, even if the underlying physiology remains identical. This principle is easiest to understand with something like body temperature. A reading taken immediately after a hot shower will differ from one taken after sitting quietly in a cool room. The true core temperature hasn't changed, but the measurement conditions have produced a different result. No one would diagnose a fever based on that post-shower reading, because we intuitively understand that context matters. Blood pressure follows the same logic, though the contextual factors are less obvious. The body's cardiovascular system is exquisitely responsive to internal and external cues. It adjusts moment by moment to meet changing demands. This responsiveness is a sign of health, not dysfunction. A flexible system can handle whatever comes its way, but it also means that blood pressure readings are inherently variable, and that capturing a meaningful snapshot requires careful attention to the conditions of measurement. Consider what happens when you walk into a medical office. You may have climbed stairs, walked down corridors, experienced the mild stress of navigating traffic and finding parking. Your sympathetic nervous system, the branch responsible for fight or flight responses, activates in response to this activity and anticipation. Blood vessels constrict slightly. Heart rate increases. Blood pressure rises. This is normal physiology, not pathology. If blood pressure is taken immediately, without allowing time for this activation to subside, the reading will reflect not your resting state, but your aroused state. The difference can be substantial, enough to move someone from the normal range into a category that might prompt concern or treatment. The body hasn't changed, the measurement conditions have. This is why the concept of resting blood pressure is so fundamental to accurate assessment. The clinical definition of hypertension is not simply high blood pressure at any moment, but abnormally high pressure during physiological rest. The body is supposed to elevate pressure during activity and stress. That's what it's designed to do. The concern arises when pressure remains elevated even when the body has no particular demands placed upon it. Capturing this resting state requires creating conditions that allow the sympathetic nervous system to settle. In practical terms, this means sitting quietly for at least 5 minutes before measurement. 10 is better, in a comfortable position with back supported. Feet flat on the floor, legs uncrossed. The environment should be quiet and calm. Conversation should wait until after the reading is complete. The goal is to approach something approximating true physiological rest. Recognizing that perfect rest is an ideal we approximate rather than achieve. The position of the body during measurement matters in ways that go beyond relaxation. Arm position, in particular, exerts a significant effect through the physics of hydrostatic pressure. When the arm hangs down at the side, the cuff sits below the level of the heart. Gravity increases the pressure within the arteries of the lower arm, and this additional pressure registers in the reading. When the arm is raised above heart level, the opposite occurs. Pressure reads artificially low. The correct position places the cuff at the same vertical level as the heart. For most people sitting upright, this means resting the arm on a table or armrest at approximately chest height. The arm should be relaxed and supported, not held in position by muscle tension, because muscular engagement itself can elevate readings through increased metabolic demand and sympathetic activation. Even the specific arm used matters. Blood pressure can differ between left and right arms in many individuals, sometimes substantially. These differences may reflect anatomical variation, arterial asymmetry, or underlying vascular conditions. The key is consistency, using the same arm for every measurement so that readings can be compared meaningfully over time. The left arm is conventional for standardization, but consistency matters more than which arm is chosen. The equipment itself introduces additional variables. Cuffs must fit properly. The bladder inside the cuff should encircle at least 80% of the arm's circumference. Cuffs that are too small for the arm produce artificially high readings because they must generate excessive pressure to compress the artery. Cuffs that are too large may underread. The cuff must also be positioned correctly, with the center of the bladder directly over the brachial artery on the inner aspect of the arm. Cuff tightness before inflation requires a specific balance. A cuff applied too loosely will not transmit pressure effectively. A cuff applied too tightly, with significant tension before inflation, preloads the tissues with compression, potentially elevating readings. The standard guideline allows for 2 fingers to be inserted between cuff and skin. More than 2 fingers indicates looseness. Fewer than 2 indicates excessive tightness. Even the clothing beneath the cuff affects results. Placement over a shirt sleeve, even a thin one, introduces a buffer that interferes with proper compression of the artery. The cuff should be applied directly to bare skin. This means removing or pushing aside any clothing that covers the upper arm, not simply rolling up a sleeve that may create a tourniquet effect above the cuff. These details may seem fussy, even excessive, but each one has been shown in research to affect readings by several points, sometimes by 10 points or more. Cumulatively, a person making multiple errors could obtain readings that are 20 to 30 points higher than their true resting pressure. That difference can move someone from normal range into a category that might prompt medication. The measurement itself, not the underlying physiology, becomes the driver of clinical decisions. The body's internal landscape, factors within that shape measurements, beyond the external conditions of measurement. Factors within the body itself influence readings in ways that may or may not reflect underlying cardiovascular health. These internal factors are not errors in the same sense as poor technique. They represent real physiological states. But they are transient states, not fixed traits, and readings obtained under their influence may not represent typical function. A full bladder provides a clear example. When the bladder distends, it activates sympathetic nervous system activity through neural pathways connecting the bladder to spinal and brain centers. This activation raises blood pressure through multiple mechanisms: increased heart rate, peripheral vasoconstriction, and altered hormonal signaling. The effect is substantial enough that measuring pressure with a full bladder can elevate readings significantly above true resting levels. The physiological logic here is straightforward. In ancestral environments, a full bladder signaled that elimination was necessary, and elimination required a degree of vigilance against potential threats. The body's stress response activated accordingly. Today, this same response simply means that blood pressure measured before urination may not reflect your typical resting state. Recent food and beverage consumption introduces additional variables. Digestion requires increased blood flow to the gastrointestinal system, and the body makes complex cardiovascular adjustments to accommodate this demand. A large meal can affect readings for hours afterward. More dramatically, caffeine-containing beverages exert direct pharmacological effects. Caffeine blocks adenosine receptors, stimulates sympathetic nervous system activity, and causes vasoconstriction. A single cup of coffee can raise systolic pressure by 20, 30, or even 40 points in sensitive individuals. Unlike the effects of a full bladder or poor positioning, caffeine's influence cannot be resolved by a few minutes of quiet relaxation. Once caffeine is in your system, it remains there until your liver metabolizes it, a process that takes several hours. No amount of deep breathing or calm sitting will fully counteract its vascular effects. The elevated reading reflects real pharmacology, not just measurement artifact, but it reflects a temporary pharmacological state rather than your underlying resting pressure. Physical activity before measurement produces similar concerns. Exercise elevates blood pressure through increased cardiac output and metabolic demand. This elevation can persist for some time after activity ceases, depending on the intensity and duration of the exercise. Measuring too soon after physical exertion captures recovery physiology, not resting physiology. Even body position before measurement matters. Standing or sitting upright activates cardiovascular adjustments to maintain blood flow against gravity. Lying down eliminates these gravitational demands. This is why blood pressure readings can differ between positions, and why consistent positioning matters for meaningful comparison. The circadian rhythm adds another layer of complexity. Blood pressure naturally fluctuates over 24 hours, typically lowest during deep sleep, rising in the hours before awakening, peaking in mid-morning, and gradually declining through the afternoon and evening. A reading taken at 7 in the morning may differ from one taken at 7 in the evening, even under identical measurement conditions. Neither reading is wrong. They simply reflect different points in the body's daily rhythm. For individuals taking blood pressure medications, timing relative to dosing introduces still more variation. Medications are typically designed to provide coverage over a specific duration. Readings taken at the end of a dosing interval may be higher than those taken shortly after medication, when drug levels peak. Understanding this pattern helps explain why pressure might vary throughout the day, even with consistent treatment. The problem of single moments. Why one reading cannot tell the whole story. Given all these sources of variation, it becomes clear that any single blood pressure reading represents just one moment in a continuous, dynamic process. That moment may capture your typical pressure under optimal conditions, or it may capture an unusual high or low point influenced by temporary factors. Without additional readings, you have no way to know which scenario applies. This limitation affects clinical practice as much as home monitoring. When a healthcare provider takes a single reading in the office and uses it to make diagnostic or treatment decisions, they are implicitly treating that moment as representative of your overall status. But research consistently shows that single office readings correlate only modestly with average pressure over time. They miss the natural variation that characterizes healthy cardiovascular function, and they may overreact to transient elevations caused by the stress of the medical encounter itself. White coat hypertension, the phenomenon of elevated pressure in medical settings that normalizes at home, illustrates this problem dramatically. Some individuals consistently show higher readings when measured by healthcare providers than when they measure themselves under relaxed home conditions. The difference can be substantial, and if only office readings were considered, these individuals might be diagnosed with hypertension and started on medication they don't need. Masked hypertension represents the opposite pattern: normal readings in medical settings, but elevated pressure at home or during daily life. This pattern is more dangerous because it goes undetected without home monitoring. Individuals may believe their pressure is well controlled when in fact they spend most of their time with elevated readings that increase cardiovascular risk. Both patterns highlight the fundamental limitation of single-moment measurements. Blood pressure is not a fixed trait like eye color. It is a dynamic variable that responds continuously to internal and external conditions. Capturing it meaningfully requires multiple measurements over time, taken under standardized conditions, interpreted with attention to patterns rather than isolated points. For diagnostic purposes, current guidelines recommend confirmation through multiple readings on separate occasions. Home monitoring plays an increasingly important role in this process, providing readings from your natural environment that may better reflect typical pressure than office measurements. Some healthcare providers also recommend ambulatory monitoring, a device worn for 24 hours that takes readings at regular intervals throughout the day and night for the most complete picture. For individuals already managing hypertension, home monitoring provides essential feedback about treatment effectiveness. Patterns over time reveal whether medications are working as intended, whether pressure remains controlled throughout the dosing interval, and whether lifestyle changes are producing measurable effects. A single reading matters less than the trajectory revealed by many readings. Extending the principles. What blood pressure teaches about other health measurements. The lessons learned from blood pressure measurement apply broadly across other health metrics we track. Each measurement we take of our bodies carries similar sensitivities to technique, timing, and context. Each represents just one moment in a dynamic process. Each requires multiple readings over time to reveal meaningful patterns. Body weight provides a clear parallel. Weight fluctuates constantly based on fluid balance, meal timing, bowel and bladder contents, and countless other factors. A single reading can vary by several pounds depending on when it's taken and under what conditions. The person who weighs themselves daily and obsesses over each fluctuation misses the point entirely. It's the trend over weeks and months that matters, not the number on any given morning. The same logic applies to weighing technique. Consistent conditions, same time of day, same scale, same type of clothing or lack thereof, same relation to meals and elimination. Allow comparisons over time that reveal true changes in body mass rather than transient fluctuations. Without this consistency, the numbers become essentially meaningless, reflecting measurement artifact as much as actual weight change. Blood glucose monitoring reveals similar sensitivities. Readings vary based on time since last meal, composition of that meal, physical activity, stress levels, and even the specific site from which blood is obtained. A single reading provides limited information, patterns over time. especially in relation to meals and activities. Offer genuine insight into glucose regulation. Cholesterol testing, typically done in medical settings, also depends on preparation. Fasting status affects results, particularly triglyceride levels. Recent meals can temporarily alter lipid profiles. Illness or injury can produce transient changes. Even the time of year may matter. Some research suggests cholesterol levels fluctuate seasonally, perhaps related to diet, activity, or sunlight exposure. The common thread across all these measurements is the need for context. A number without context is just a number. It carries no inherent meaning about your health. A number with context, knowledge of the conditions under which it was obtained, awareness of your typical range, understanding of factors that might have influenced it, becomes information you can actually use. This is why healthcare providers ask about fasting before blood draws, why they want to know whether you've been ill, why they may repeat tests that come back surprising. They are seeking the context that transforms raw data into clinical insight. The same principle applies to home monitoring. The more context you have about your measurements, the more useful they become. The inner experience. Why how you feel still matters. For all the power of modern health measurements, they capture only part of the story. They tell us about numbers, pressures, weights, chemical concentrations. They do not tell us about experience, how we feel, how we function, how we move through our days with energy and purpose. This distinction matters because the relationship between measured values and experienced well-being is not always straightforward. Two people with identical blood pressure readings may feel entirely different, one energetic and vibrant, the other fatigued and limited. Two people with similar cholesterol levels may have completely different cardiovascular outcomes, depending on countless other factors that measurements don't capture. The modern emphasis on numbers can inadvertently lead us to neglect the inner experience. We become so focused on achieving target readings that we forget to notice how we actually feel. We celebrate weight loss even if it came at the cost of constant hunger and low energy. We feel reassured by normal lab results even if we haven't felt truly well in months. This is not to suggest that measurements lack value. They provide essential information that our subjective experience cannot. We cannot feel elevated blood pressure or silent atherosclerosis. We cannot sense gradually rising blood sugar until it reaches levels that produce symptoms. The numbers alert us to problems we would otherwise miss. But the numbers are tools, not masters. They serve our understanding of health without defining it entirely. The goal is not to achieve perfect numbers at any cost. It is to live well, with numbers that support rather than dominate our sense of well-being. This perspective becomes especially important in later life, when the natural processes of aging produce changes in many measured values. Blood pressure may trend upward as arteries become less elastic. Glucose regulation may become slightly less efficient. Muscle mass may gradually decline. These changes reflect the passage of time, not necessarily disease. The question is not whether numbers differ from those of youth, but whether they remain within ranges associated with continued good function and whether they are stable or rapidly changing. The art of home monitoring. Creating your own health database. For those who choose to monitor health metrics at home, the process can become a form of engaged self-care, not anxious checking, but thoughtful observation. The key is approaching it with the right mindset and techniques. Begin with equipment quality. Not all home monitors are equally accurate. For blood pressure, choose an upper arm monitor from a reputable manufacturer that has been validated in clinical testing. Wrist monitors offer convenience, but generally provide less reliable readings due to their sensitivity to position. For weight, a simple digital scale that provides consistent readings works, as well as expensive models with body composition analysis. The extra features often introduce more confusion than insight. Establish consistent measurement conditions. For blood pressure, this means the same time of day, the same arm, the same preparation, empty bladder, no caffeine, 5 minutes of quiet sitting, the same positioning. For weight, it means the same time of day, morning after voiding but before eating is conventional, the same scale, the same type of clothing or lack thereof. Take multiple readings. For blood pressure, 2 or 3 readings separated by a minute provide a better estimate than any single reading. The first reading is often highest. The average of the second and third may better reflect true pressure. For weight, daily weighing with attention to weekly averages smooths out daily fluctuations. Record your readings systematically. A simple logbook or smartphone app allows you to track patterns over time and share information with healthcare providers when needed. Include not just the numbers, but relevant context, time of day, recent meals, how you're feeling, any medication changes. Interpret patterns, not isolated points. A single high reading means little if your typical readings are well within target range. A single low reading means little if you feel fine and your readings usually run higher. What matters is the trajectory, the direction your numbers are moving over weeks and months. Share your data with healthcare providers. Home monitoring provides information that office visits cannot, readings from your natural environment, taken under conditions that reflect your typical life. Many providers appreciate having this data, as it gives a more complete picture than occasional office readings alone. But also hold the data lightly. Numbers are information, not identity. A high reading does not make you a failure or a bad person. It is simply data, information that may guide decisions about diet, activity, medication, or further evaluation. The goal is not to achieve perfect numbers as a measure of self-worth, but to use numbers as tools for living well. When numbers worry, responding to concerning readings, despite best efforts at consistent measurement and calm interpretation. Concerning readings will occasionally appear. A blood pressure reading far above your typical range. A weight that has jumped several pounds in a few days. A blood sugar level that exceeds your usual pattern. How should you respond? First, resist panic. A single concerning reading, especially if it represents a significant departure from your pattern, may reflect temporary factors rather than true change. Did you measure under unusual conditions? Have you been under unusual stress? Did you forget to empty your bladder? Did you consume something that could affect the reading? Before assuming the worst, consider whether measurement conditions explain the result. Second, repeat the measurement after addressing any obvious factors. For blood pressure, this means sitting quietly for another 5 minutes and taking another reading. Often the second reading will be closer to your typical range. For weight, this means weighing again the next morning under standard conditions, recognizing that daily fluctuations are normal. Third, look for associated symptoms. Do you feel different in ways that concern you? Chest discomfort, shortness of breath, severe headache, vision changes, weakness. These symptoms, combined with significantly elevated pressure, warrant prompt medical attention. But in the absence of symptoms, a single high reading rarely represents an emergency. Fourth, consider the broader pattern. Is this reading part of a gradual upward trend you've been noticing? Or does it stand alone as an isolated spike? Trends matter more than individual points. If your readings have been gradually rising over weeks or months, that pattern deserves discussion with your healthcare provider, even if no single reading is dramatically high. Fifth, contact your healthcare provider when patterns concern you or when you have questions about interpretation. They know your full medical context and can help you understand what your numbers mean for your specific situation. They may adjust medications, recommend additional testing, or simply reassure you that your readings remain within acceptable ranges. Beyond measurement, The deeper dimensions of health. For all their utility, health measurements capture only what can be quantified. They do not capture the experience of waking up feeling rested, of moving through the day with energy and purpose, of connecting meaningfully with others, of finding satisfaction in work and leisure, of facing challenges with resilience and hope. These dimensions of health matter as much as any number on a gauge. They shape our experience of being alive in ways that measurements cannot access, and they influence the very outcomes that measurements track. People who live with purpose and connection tend to have better cardiovascular health, better metabolic regulation, better cognitive function as they age. This is not an argument against measurement. It is an argument for keeping measurement in perspective. The numbers help us identify problems and track progress, but they do not define the entirety of health. A person with perfect numbers who lives in isolation and despair is not fully healthy. A person with less than perfect numbers who lives with vitality and connection may be healthier than their readings suggest. The challenge, particularly in later life, is holding both perspectives simultaneously, attending to the information that measurements provide without being ruled by it. This requires a kind of wisdom that cannot be reduced to any single metric. It develops over time through experience, through paying attention to how our bodies feel and respond, through learning which numbers matter for our specific situation and which can be held more lightly. For those who have spent decades tracking various health metrics, this wisdom may come naturally. They have seen numbers fluctuate and have learned which fluctuations matter. They have experienced the limits of measurement and the value of subjective experience. They have developed a balanced approach that uses numbers as tools without becoming enslaved to them. For those newer to health monitoring, the path to wisdom involves experimentation and observation. Pay attention to how you feel when your numbers are in different ranges. Notice whether achieving certain targets actually improves your experience of daily life. Learn which measurements provide useful guidance for your situation and which create unnecessary anxiety without adding value. The social context. Health measurement in relationship. Health measurements do not occur in isolation. They happen within relationships, with healthcare providers, with family members who may worry about our numbers, with friends who share their own tracking experiences. This social context shapes how we interpret and respond to our measurements in ways we may not fully recognize. The relationship with healthcare providers carries particular weight. When a provider expresses concern about a reading, that concern influences how we view that number. When a provider dismisses our questions about home monitoring, we may feel discouraged from continuing. When a provider takes time to explain what our numbers mean and how they relate to our overall health, we gain tools for better self-understanding. The ideal relationship involves partnership rather than hierarchy. You bring your home monitoring data, your observations about how you feel, your questions and concerns. Your provider brings clinical knowledge, experience with similar situations, access to testing and treatment options. Together you interpret your measurements and make decisions about next steps. Family relationships also shape the measurement experience. Adult children may worry about aging parents' blood pressure readings, creating pressure to monitor and report. Spouses may notice changes before we do, or may express concern about numbers we hadn't considered concerning. These dynamics can support health or create tension, depending on how they're navigated. The key is maintaining your own relationship with your measurements, even as you remain open to input from others. You are the one living in your body, experiencing your days, noticing how you feel. Others can offer perspective and concern, but they cannot feel what you feel. Your experience matters as much as any number they see. The limitations of numbers. What measurements cannot tell us, for all their utility. Health measurements carry inherent limitations that deserve acknowledgement. They capture moments, not lives. They quantify certain processes while leaving others entirely invisible. They create the illusion of precision while obscuring the complexity that characterizes all living systems. Measurements cannot tell us why a number is what it is. A blood pressure reading may be elevated, but the reading itself doesn't reveal whether that elevation stems from dietary patterns, stress, medication timing, sleep quality, or underlying vascular changes. Only context and pattern analysis can suggest possible explanations. Measurements cannot tell us what to do about a number. A high reading may prompt medication, lifestyle changes, further testing, or watchful waiting depending on the full clinical picture. The number alone does not dictate the response. Measurements cannot capture the experience of living in a body. They cannot register the pleasure of a good walk, the satisfaction of meaningful work, the warmth of connection with loved ones, the peace of a quiet evening. These experiences are health too, though no device measures them. Measurements cannot predict individual outcomes with certainty. Population statistics describe averages, not individuals. A person with slightly elevated readings may live vigorously into advanced age, while another with perfect readings may develop unexpected problems. The numbers inform probabilities but do not determine destinies. These limitations do not render measurements useless. They simply place them in proper perspective, as tools that provide useful information within a broader context of lived experience and clinical judgment. Toward integration. Living wisely with health measurements. The goal of this exploration has not been to discourage health monitoring, but to encourage wiser engagement with it. Measurements offer valuable information when obtained carefully and interpreted thoughtfully. They become problematic when treated as definitive judgments rather than useful tools. The path forward involves integration, bringing together the objective information that measurements provide with the subjective experience of living in your body. Neither perspective alone tells the full story. Together, they create a more complete picture that can guide decisions while honoring the complexity of human health. For blood pressure specifically, this means creating conditions for accurate measurement, taking multiple readings over time, interpreting patterns rather than isolated points, sharing data with healthcare providers, and holding numbers lightly enough that they inform without dominating. It means recognizing that blood pressure is dynamic, responsive, and variable, and that capturing it meaningfully requires methods that account for these realities. For other health measurements, similar principles apply. Consistency in technique and conditions allows comparison over time. Multiple readings reveal patterns that single readings obscure. Context, how you feel, what you've eaten, how you've slept, transforms raw data into meaningful information. Sharing with providers creates partnership rather than isolation. Holding numbers lightly maintains perspective. For health itself, the deepest wisdom involves recognizing that numbers serve life, not the reverse. The point of monitoring blood pressure is not to achieve perfect readings, but to live well with energy, purpose, connection, and the capacity to do what matters most. Measurements that support this goal have value. Measurements that undermine it through anxiety and obsession have become obstacles rather than aids. This perspective becomes more available with age and experience. The person who has lived long enough to see numbers fluctuate, to recover from concerning readings, to outlive dire predictions, may hold health measurements with appropriate lightness. They have learned that today's concerning number may be tomorrow's forgotten blip. They have learned that how they feel matters as much as what any device reports. They have learned that health is finally about living, not about the numbers that track it. A final reflection. The next time you find yourself on that examination table, cuff tightening around your arm, awaiting the number that will be recorded in your chart, you might pause to consider everything that number represents. It represents a moment in time, captured under specific conditions. influenced by countless variables you may or may not control. It represents useful information when interpreted in context, potential misinformation when treated as definitive truth. It represents one small piece of the larger puzzle that is your health. You might also consider what the number does not represent. It does not represent your worth as a person. It does not represent the sum total of your health practices. It does not represent your future with certainty. It does not represent the experience of living in your body, the sensations, the relationships, the purposes that give your days meaning. Numbers will come and go. Readings will fluctuate. Some will concern. Some will reassure. Through it all, you remain the one living your life, making your choices, experiencing your days. The numbers can inform those choices without determining them. They can guide without governing. They can serve without mastering. This is the wisdom that transforms health measurement from anxious checking into engaged self-care. It is the wisdom that allows us to use modern tools without being used by them. And it is the wisdom that becomes available to anyone willing to hold their numbers lightly while living their lives fully, whatever those numbers may be. The central insight we return to again and again is this. Numbers can inform us, but they should never define us. They are tools for understanding, not judgments on our worth or predictors of our destiny. If today's exploration has sparked any thoughts about your own relationship with health measurements, how you take them, how you interpret them, how much weight you give them, we'd be grateful if you'd share those reflections in the comments. This library grows richer with every voice that joins the conversation. And if you'd like to continue this journey through the wisdom of healthy aging, we invite you to explore other videos in our collection and subscribe so you never miss new additions to the archive. Until next time, may your measurements be accurate, your interpretations be wise, and your life be full. This is the Longevity Library. Listen, learn, and live longer.